Question 1. Topic: Vocational Counseling and Career Development. James, a rehabilitation counselor, is working with a client who has been recently diagnosed with a disability that severely limits their mobility. The client is seeking employment and is unsure about which career path to pursue due to their condition. James has administered several vocational assessments to assess the client's abilities, interests, and skills, but is unsure about the next steps. Counseling process. What should James focus on next to ensure the client receives the most suitable vocational guidance? A. James should focus solely on helping the client secure any available job, regardless of the suitability for their disability. B. James should conduct a job analysis to identify suitable jobs that align with the client's abilities, considering the specific limitations due to the disability. C. James should only focus on identifying any possible career fields without considering the client's limitations. D. James should prioritize social and emotional support, as job placement is not a significant concern for the client at this time. Answer: B. James should conduct a job analysis to identify suitable jobs that align with the client's abilities, considering the specific limitations due to the disability. Explanation: the most appropriate next step is to conduct a detailed job analysis that aligns with the client's abilities, skills, and limitations. Comprehensive job analysis helps match the client's strengths and skills with available job opportunities, while also considering any physical or cognitive limitations the client might face due to their disability. This process aligns with vocational rehabilitation best practices as outlined by the Rehabilitation Act of 1973, Section 504, and the Americans with Disabilities Act (ADA), which require employers to provide reasonable accommodations for individuals with disabilities. Without addressing these elements, James risks placing the client in that might exacerbate their limitations, leading to job dissatisfaction or failure. Options A, C, and D are less appropriate, as they do not adequately consider the specific needs and capabilities of the client, nor do they adhere to best practices in vocational rehabilitation. Question 2. Topic: Assessment and Diagnosis. A rehabilitation counselor is conducting an assessment on a client who has recently become paraplegic after a car accident. The counselor needs to assess the client's functional limitations and psychological state in order to create a rehabilitation plan. Which of the following assessment methods is most appropriate for understanding both the psychological and physical aspects of the client's condition? A. Administering a psychological evaluation, such as the MPI, and focusing only on the psychological symptoms the client is experiencing. B. Conducting a thorough functional assessment to evaluate the client's ability to perform basic tasks, along with administering a psychosocial assessment to understand the emotional impact. C. Using a standardized test to evaluate the client's cognitive abilities before considering any limitations. D. Focusing on the psychological assessment alone and delaying the physical assessment until the client's emotional state stabilizes. Answer: B. Conducting a thorough functional assessment to evaluate the client's ability to perform basic tasks, along with administering a psychosocial assessment to understand the emotional impact. Explanation: a comprehensive approach that includes both functional assessments evaluating the client's ability to perform activities of daily living and psychosocial assessments exploring the emotional and psychological impact of the disability is necessary. Functional assessment evaluates the impact of the disability on the client's ability to engage in work, self-care, and other everyday tasks. The psychosocial assessment explores the emotional and mental health aspects, which can significantly influence the rehabilitation process. This holistic approach aligns with best practices in rehabilitation counseling as outlined by the American Counseling Association and various state regulations, ensuring that the count addresses both the client's physical and emotional needs in creating an individualized rehabilitation plan. Options A, C, and D are less comprehensive and fail to adequately consider the combination of factors influencing the client's rehabilitation process. Question 3. Scenario question. Topic: Ethical and legal standards. Mr. Davis is a rehabilitation counselor working with a client who has a traumatic brain injury (TBI). The client has been progressing in therapy but has also been experiencing some issues with substance use. The client shares with Mr. Davis that they are considering using recreational drugs again to manage the stress and anxiety caused by their condition, but they also are concerned about how it might affect their rehabilitation. The client requests that Mr. Davis not tell anyone about the situation, stating that they do not want anyone to know because they fear it might jeopardize their rehabilitation progress. Mr. Davis is unsure how to proceed. What should Mr. Davis do in this situation? A. Respect the client's confidentiality and not disclose any information about the substance use to anyone, as it is the client's personal choice. B. Continue working with the client on their rehabilitation goals without addressing the substance use issue directly, as it could cause setback in therapy. C. Disclose the information to the treatment team or other healthcare providers, as substance use could impact the client's progress and it's important to intervene for their well-being. D. Encourage the client to discontinue therapy until they have fully addressed the substance use issue. Answer: C. Disclose the information to the treatment team or other healthcare providers, as substance use could impact the client's progress and it's important to intervene for their well-being. Explanation: while confidentiality is a critical component of rehabilitation counseling, it is also important to recognize situations where disclosure is necessary for the client's health and safety. In this scenario, the client's substance use could directly impact rehabilitation progress, potentially hindering their recovery and affecting the therapeutic relationship. According to the ethical standards set forth by the American Rehabilitation Counseling Association, ARCA, and supported by laws such as HIPAA, Health Insurance Portability and Accountability Act, counselors are required to disclose information if there is risk of harm to the client or others. Mr. Davis should collaborate with the treatment team with the consent when possible to ensure a holistic approach to the client's well-being, integrating both physical rehabilitation and support for managing substance use. Option A disregards the potential risk to the client's progress, while B and D fail to address the issue of substance use effectively. Question 4. Topic: Advocacy and Case Management. Sarah, a rehabilitation counselor, is working with a client who is eligible for Social Security Disability Insurance (SSDI). The client has expressed frustration with the delays in receiving their benefits and is unsure about how to proceed. Sarah is concerned that the client might not fully understand the process and may need additional advocacy to expedite their case. What is the best course for Sarah to take to assist the client in this situation? A. Sarah should advise the client to continue waiting for the SSDI decision without further action, as it may take time to process. B. Sarah should help the client gather all the necessary documentation and assist in contacting the appropriate agencies to advocate for a faster decision. C. Sarah should suggest the client apply for another form of financial assistance, such as temporary assistance for needy families (TANF), without further SCI. D. Sarah should inform the client that they are responsible for navigating the SSDI system independently and that no additional assistance can be provided. Answer: B. Sarah should help the client gather all the necessary documentation and assist in contacting the appropriate agencies to advocate for a faster decision. Explanation: as part of her advocacy role, Sarah should assist the client in gathering documentation and contacting relevant agencies to ensure the SSDI application process moves forward. Rehabilitation counselors are often responsible for helping clients navigate complex systems like SSDI, ensuring that all necessary paperwork is completed accurately and advocating on their behalf to reduce delays. The Rehabilitation Act of 1973 and Section 504, along with the ADA, emphasize the importance of advocacy for individuals with disabilities, which includes helping clients secure entitlements like SSDI. Option A and D neglect the counselor's responsibility to advocate on behalf of the client, while C would distract from the more appropriate SSEI advocacy. Question 5. Topic: Treatment planning and intervention. Emily, a rehabilitation counselor, is working with a client who has been diagnosed with depression and is also struggling with substance abuse. After a comprehensive assessment, Emily develops an individualized rehabilitation plan with both short and long-term goals. Which of the following strategies should Emily prioritize to enhance the likelihood of the client's success in the rehabilitation process? A. Focusing only on the client's depression and ignoring the substance abuse issue for now, as it may resolve over time. B. Setting long-term goal of complete sobriety without focusing on the client's emotional well-being first. C. Incorporating both emotional and substance abuse treatment goals into the and using techniques like cognitive behavioral therapy (CBT) and motivational interviewing to address both issues simultaneously. D. Focusing solely on the client's emotional well-being and delaying the substance abuse treatment until the client feels ready. Answer C. Incorporating both emotional and substance abuse treatment goals into the ERP and using techniques like cognitive behavioral therapy (CBT) and motivational interviewing to address both issues simultaneously. Explanation. In cases where a client faces both mental health and substance abuse issues, a holistic treatment plan is essential. It is crucial to address both emotional and substance abuse problems simultaneously as they're often interconnected. Cognitive behavioral therapy (CBT) and motivational interviewing are evidence-based techniques commonly used in rehabilitation counseling to help clients address these issues effectively. This approach supports the client's psychological recovery while also addressing behaviors related to substance abuse, promoting long-term success. The Rehabilitation Act and ADA emphasize the importance of comprehensive rehabilitation plans that account for both physical and mental health needs. Options A, B, and D would neglect the multifaceted nature of the client's rehabilitation process, which could delay or hinder progress. Question 6. Topic: Disability rights and legislation. A rehabilitation counselor is assisting a client with securing accommodations for their new job as they have a visual impairment. The employer is resistant to providing the accommodations, arguing that the costs are too high. What should the counselor advise the client to do in this situation? They advise the client to accept the employer's decision and not pursue accommodations further. B. Encourage the client to seek legal advice and inform them of their rights under the Americans with Disabilities Act (ADA). C. Recommend the client change jobs to one that does not require accommodations. D. Suggest that the client try to work without accommodations as it may be too difficult to argue for them. Answer B. Encourage the client to seek legal advice and inform them of their rights under the Americans with Disabilities Act (ADA). Explanation. Under the ADA, employers are required to provide reasonable accommodations for employees with disabilities unless doing so would cause undue hardship. The Rehabilitation Act of 1973, Section 504, and other disability rights legislation further reinforce the obligation of employers to provide these accommodations. If an employer refuses to provide reasonable accommodations, the rehabilitation counselor should encourage the client to seek legal advice and pursue their rights under the ADA. This ensures that the client is treated fairly and their workplace needs are met. Option A, C, and D are not appropriate as they do not support the client's legal rights or advocate for fair treatment in the workplace. Question 7. Topic: Counseling techniques and approaches. David is a rehabilitation counselor working with a client who has been diagnosed with a severe anxiety disorder and is hesitant to engage in any therapeutic interventions. The client is unsure about how therapy will help them and fears that it might not be effective. Which therapeutic approach should David consider first to help the client feel more comfortable with the process? A. Use a directive approach to tell the client that therapy will definitely work and they should commit to it immediately. B. Introduce cognitive behavioral therapy (CBT) as a structured method focusing on changing specific thought patterns related to the anxiety. C. Use motivational interviewing to engage the client in a non-confrontational manner, exploring their ambivalence about therapy and building readiness for change. D. Start by only on the client's anxiety symptoms and avoid discussing the potential benefits of therapy. Answer C. Use motivational interviewing to engage the client in a non-confrontational manner, exploring their ambivalence about therapy and building readiness for change. Explanation. Motivational interviewing is a client-centered, non-confrontational approach that is particularly effective when working with clients who are ambivalent about engaging in therapy. It allows the counselor to explore the client's feelings, concerns, and motivations regarding therapy while fostering collaboration. This approach helps to build readiness for change without imposing an agenda. CBT, option B, is helpful intervention. Motivational interviewing is often more appropriate first step for clients who are unsure about the benefits of therapy. Options A, B, and D may be too directive or narrow in scope, which can potentially alienate the client or prevent them from fully engaging in the therapeutic process. Question 8. Topic: Cultural competence and diversity. Anna, a rehabilitation counselor, is working with a client from a cultural background different from her own. The client expresses that they feel misunderstood by previous counselors who did not take their cultural beliefs into account when developing treatment plans. How should Anna approach the situation to provide culturally competent services? A. She should assume that her personal understanding of the client's culture is sufficient and proceed with the treatment plan she already developed. B. She should acknowledge the client's concerns and ask questions to better understand their cultural values and how those might influence the treatment plan. C. She should disregard the cultural background and focus solely on the client's disability when developing the treatment plan. D. She should encourage the client to adopt the counselor's values to ensure more effective treatment. Answer: B. She should acknowledge the client's concerns and ask questions to better understand their cultural values and how those might influence the treatment plan. Explanation: cultural competence is an essential skill for rehabilitation counselors. It involves understanding and respecting clients' cultural beliefs, values, and practices, and incorporating the understanding into the treatment planning process by asking open-ended questions and seeking to understand the client's unique cultural perspective. Anna can create more personalized and effective treatment plan that aligns with the client's values. The Rehabilitation Act and ADA emphasize cultural awareness and sensitivity in service delivery. Option A assumes that cultural competence can be achieved without active engagement, while C overlooks the importance of cultural factors in treatment. Option D may inadvertently impose the counselor's values on the client, which is contrary to cultural competence principles. Question 9. Topic: Client empowerment and self-advocacy. Maria, a rehabilitation counselor, is working with a client who has a physical disability and is struggling to find employment. The client expresses a lack of confidence in their abilities and feels discouraged by previous job rejections. What is the most appropriate strategy Maria should use to empower the client? A. Maria should focus solely on improving the client's resume and not discuss self-confidence issues. B. Maria should encourage the client to accept low-level jobs that don't require accommodations. C. Maria should work with the client to set achievable career goals, build self-advocacy skills, and develop strong support system. D. Maria should tell the client that finding a job is a difficult process and they should be prepared for long-term unemployment. Answer: C. Maria should work with the client to set achievable career goals, build self-advocacy skills, and develop a strong support system. Explanation: empowering the client involves helping them develop self-advocacy skills, build confidence, and set realistic goals for their career. By focusing on these areas, Maria can help the client take ownership of their job search and increase their motivation and self-esteem. Building a strong support system also crucial as it provides encouragement and practical assistance. Option A only addresses one aspect of the process, while B and D limit the client's potential and may foster a sense of helplessness. Question 10. Topic: Legal and ethical considerations in rehabilitation counseling. A rehabilitation counselor receives a request from a client to release their confidential records to a third party. The client has signed a release of information form, but the counselor is concerned that releasing the information may violate the client's privacy. What should the counselor do next? A. Release the information as requested, since the client signed the release form. B. Release the information, but only after discussing with the client the potential risks and ensuring they fully understand the implications. C. Refuse to release the information even though the client has signed the form because of the counselor's ethical obligation to protect client privacy. D. Ignore the release form and do not disclose any information to the third party. Answer: B. Release the information, but only after discussing with the client the potential risks and ensuring they fully understand the implications. Explanation: even though the client has signed the release form, counselors have an ethical obligation to ensure that the client fully understands the potential consequences of disclosing their information. This includes discussing the risks to privacy and ensuring that the release is voluntary and informed consent. Essential in maintaining trust and ethical practice in rehabilitation counseling. Option A disregards the counselor's responsibility to ensure informed consent, while C may be overly cautious. Option D neglects the importance of following proper legal procedures. Question 11. Topic: Crisis intervention and support. John, a client, presents to his rehabilitation counselor feeling overwhelmed after experiencing a recent personal loss. He is expressing thoughts of hopelessness and has been withdrawing from social interactions. The counselor is concerned about John's mental health. What is the most appropriate immediate action the counselor should take? A. Advise John to try to overcome his feelings on his own without seeking additional help. B. Encourage John to talk about his feelings and provide immediate emotional support while also referring him to a mental health professional for further assessment. C. Tell John that everyone experiences loss and he should simply move on with his life. D. Focus on the client's disability and postpone any discussion about the personal loss until later. Answer: B. Encourage John to talk about his feelings and provide immediate emotional support while also referring him to a mental health professional for further assessment. Explanation: in a crisis situation, it's crucial to provide immediate emotional support while addressing the client's immediate needs. Referring John to mental health professional for further evaluation is essential in ensuring that he receives appropriate care. This approach acknowledges the seriousness of his feelings and demonstrates empathy and professionalism. Option A dismisses the importance of seeking help, and option C may invalidate the client's feelings. Option D focuses too narrowly on the client's disability without addressing the immediate emotional crisis. Question 12. Topic: Vocational rehabilitation and job development. Michael, a client with a developmental disability, is interested in finding employment in a retail setting. However, he has limited work experience and requires accommodations for specific job tasks. What is the most effective way the rehabilitation counselor can assist Michael in securing employment? A. Advise Michael to apply only for jobs that do not require accommodations. B. Help Michael identify jobs that align with his skills and interests and assist in negotiating reasonable accommodations with potential employers. C. Suggest that Michael pursue a job that is unrelated to retail, as it might be easier to find employment in another field. D. Tell Michael that the job search process is likely to be unsuccessful and suggest he on alternative activities. Answer: B. Help Michael identify jobs that align with his skills and interests and assist in negotiating reasonable accommodations with potential employers. Explanation: the rehabilitation counselor's role is to assist the client in identifying suitable job opportunities based on their abilities, interests, and strengths. Additionally, advocating for reasonable accommodations with potential employers is critical to ensuring that the client can perform his job functions. Option B aligns with the principles of vocational rehabilitation, which emphasizes self-determination, access to opportunities, and accommodation. Options A, C, and D limit the client's potential and do not fully consider their needs or goals. Question 13. Topic: Transition services for youth. Jessica, a rehabilitation counselor, is working with a high school student with a disability who will be graduating soon. The student has expressed an interest in attending college but is uncertain about their ability to succeed. How should Jessica assist this student in planning for a successful transition to post-secondary education? Advise the student to wait until they feel more confident before pursuing higher education. B. Develop a detailed transition plan that includes academic accommodations, support services, and strategies for managing stress and academic demands. C. Suggest that the student attend a vocational training program instead of college. D. Encourage the student to focus only on job opportunities and disregard higher education options. Answer: B. Develop a detailed transition plan that includes academic accommodations, support services, and strategies for managing stress and academic demands. Explanation: a key component of rehabilitation counseling for youth is providing transition services that support the individual's successful move from high school to post-secondary education or employment. Developing transition plan that includes necessary accommodations, support services, strategies for managing academic demands will help the student succeed. This aligns with the Individuals with Disabilities Education Act idea, which mandates transition planning for students with disabilities. Options A, C, and D do not adequately support the student's goal of pursuing higher education or preparing them for success. Question 14. Topic: Cultural competency and diversity. Carlos, a rehabilitation counselor, is working with a client from a culturally diverse background who expresses concern about seeking mental health support due to stigma in their community. The client is hesitant to pursue services that could help with their mental health challenges. What is the most appropriate approach Carlos should take to address the client's concerns? A. Carlos should ignore the cultural concerns and focus solely on the client's immediate needs for vocational rehabilitation. B. Carlos should respect the client's cultural beliefs and avoid suggesting mental health services altogether. C. Carlos should acknowledge the cultural stigma, offer alternative ways to address mental health challenges, and provide education on the benefits of counseling. D. Carlos should insist on the client's counseling regardless of their cultural background. Answer: C. Carlos should acknowledge the cultural stigma, offer alternative ways to address mental health challenges, and provide education on the benefits of counseling. Explanation. It is crucial to recognize and respect cultural differences in rehabilitation counseling. By acknowledging the cultural stigma surrounding mental health, Carlos can demonstrate cultural sensitivity and build rapport. Offering alternative solutions and educating the client about the benefits of counseling can empower the client to make informed decisions. This approach is consistent with the principle of cultural competence, which emphasizes understanding, respecting, and integrating cultural differences into treatment plans. Option A ignores the client's cultural context, while B and D either disregard or overly pressure the client. Question 15. Topic: Vocational Counseling and Career Development. Jessica, a rehabilitation counselor, is working with a client who has a physical disability and is interested in pursuing a career in graphic design. However, the client is concerned about their ability to meet the physical demands of the job. What should Jessica do to assist the client in navigating this concern? I advise the client to reconsider the career and explore other options that might be less demanding. B. Encourage the client to pursue the career, but without discussing potential job modifications or accommodations. C. Help the client identify ways to adapt to the workplace environment, such as recommending assistive technologies or job modifications that can support their success. D. Recommend that the client not pursue graphic design, but instead seek a job in a field that requires less training. Answer: C. Help the client identify ways to adapt to the workplace environment, such as recommending assistive technologies or job modifications that can support their success. Explanation: the rehabilitation counselor should explore ways to accommodate the client's disability while still pursuing their career goals. By recommending assistive technologies or job modifications, Jessica ensures that the client has the tools and resources necessary for success in the chosen field. This aligns with the core principles of vocational rehabilitation, which focus on creating inclusive work environments that support individuals with disabilities. Option A and D unnecessarily limit the client's potential, while B does not address the need for accommodations. Question 16. Topic: Psychological and functional assessment techniques. A rehabilitation counselor is conducting an assessment of a client who has recently been diagnosed with a cognitive disability. The counselor needs to determine the client's functional limitations and how they impact daily activities and employment. Which of the following assessments is most appropriate for this situation? A. The Wise-Wechsler Adult Intelligence Scale, to assess the client's overall cognitive abilities. B. Vocational Interest Inventory, to assess the client's interests and preferences in different career fields. C. Functional assessment tool that measures daily living skills and the ability to perform job-related tasks. D. Personality test, to assess the client's emotional stability and coping mechanisms. Answer: C. A functional assessment tool that measures daily living skills and the ability to perform job-related tasks. Explanation: when assessing functional limitations, especially in relation to daily activities and employment, the most relevant tool is one that specifically measures the client's ability to perform essential life tasks and job functions. This helps to determine the level of support needed in various settings, while the WISE option A measures cognitive abilities. It does not assess the functional limitations related to day-to-day tasks. Vocational Interest Inventory option B is valuable for career exploration, but not for assessing functional limitations. Personality test option D provides information about emotional stability but is not directly linked to functional assessment. Question 17. Topic: Case management and coordination of services. Paul, a rehabilitation counselor, is working with a client who has a spinal cord injury and is preparing for discharge from a rehabilitation hospital. The client requires a variety of services, including physical therapy, home modifications, and job training. What is the most important action Paul should take in coordinating the client's services? A. Paul should focus on arranging only the job training services and leave other needs to be addressed later. B. Paul should coordinate all necessary services, ensuring that they are integrated into a comprehensive discharge plan that addresses the client's physical, emotional, and vocational needs. C. Paul should advise the client to manage their own coordination of services to build independence. D. Paul should focus on physical therapy first, the client's most immediate need. Answer: B. Paul should coordinate all necessary services, ensuring that they are integrated into the comprehensive discharge plan that addresses the client's physical, emotional, and vocational needs. Explanation: Effective case management requires a holistic approach that addresses all aspects of clients' needs. Paul should coordinate comprehensive discharge plan that integrates physical therapy, home modifications, and job training to ensure the successful transition. This approach is aligned with the principles of case management and rehabilitation, which emphasize coordination of care across different service areas. Option A limits the scope of services, while C may place an undue burden on the client. Option D focuses too narrowly on physical therapy and neglects the broader needs of the client. Question 18. Topic: Disability rights and legislation. Maria, a rehabilitation counselor, is working with a client who has a disability and is seeking employment. The client's potential employer is hesitant to hire them due to concerns about providing accommodations. Which of the following actions should Maria take in advocating for the client? A. Advise the client to accept different job offer to avoid further conflict. B. Explain to the employer that under the ADA they are required to provide reasonable accommodations for qualified individuals with disabilities, unless it imposes an undue hardship. C. Encourage the client to work without accommodations and prove their abilities before requesting accommodations. D. Suggest that the employer be exempt from providing accommodations due to client's disability. Answer: B. Explain to the employer that under the ADA they are required to provide reasonable accommodations for qualified individuals with disabilities, unless it imposes an undue hardship. Explanation: The Americans with Disabilities Act (ADA) requires employers to provide reasonable accommodations to qualified individuals with disabilities, unless doing so would cause an undue hardship. As a rehabilitation counselor, Maria should advocate for clients' rights by educating the employer about their obligations under the law. Option A and C may lead to unnecessary compromises, while D misrepresents the employer's legal responsibilities. The counselor's role is to advocate for fair treatment and ensure that the client has access to the necessary accommodations to succeed in the workplace. Question 19. Topic: Ethical and legal standards. Sarah, a rehabilitation counselor, is working with a client who has a history of substance abuse. The client reveals that they have relapsed but has requested that Sarah not share this information with anyone, citing a desire to maintain their privacy. Weighs Sarah's ethical and legal responsibility in this situation. 8. Sarah should respect the client's request for confidentiality and not disclose the relapse to anyone. B. Sarah should encourage the client to share the relapse information voluntarily, but cannot disclose it without the client's consent. C. Sarah should disclose the relapse to the appropriate parties if it could jeopardize the client's well-being or treatment outcomes, even if the client asks for confidentiality. D. Sarah should immediately terminate counseling relationship to avoid legal repercussions for breaching confidentiality. Answer: C. Sarah should disclose the relapse to the appropriate parties if it could jeopardize the client's well-being or treatment outcomes, even if the client asks for confidentiality. Explanation: The ethical principle of beneficence, doing good and non-maleficence, avoiding harm, requires that the counselor act in the best interests of the client, even when confidentiality may need to be breached. While confidentiality is critical, there are exceptions. Client safety or treatment progress is at risk. In this case, Sarah must evaluate whether the relapse threatens the client's well-being and may be required to disclose this information to other healthcare providers or supervisors if it is essential for ensuring the client's treatment and safety. Option A is incorrect because it disregards the potential harm to the client, and option D is an overreaction. Question 20. Topic: Treatment planning and intervention. A rehabilitation counselor is developing an individualized rehabilitation plan for a client who is recovering from a traumatic brain injury (TBI). The client expresses interest in returning to work as a manager at their previous job, but they struggle with memory and attention issues. What is the most appropriate approach for the counselor in this case? A. The counselor should set an immediate goal for the client to return to their previous managerial position, regardless of their cognitive challenges. B. The counselor should help the client identify alternative job opportunities that align with their current abilities and gradually work toward re-entering the workforce in a way that accounts for their limitations. C. The counselor should suggest that the client retire early as managing a job TBI-related difficulties is too challenging. D. The counselor should work solely on helping the client overcome their memory and attention issues before considering any vocational goals. Answer: B. The counselor should help the client identify alternative job opportunities that align with their current abilities and gradually work toward re-entering the workforce in a way that accounts for their limitations. Explanation: An effective rehabilitation plan should consider the client's cognitive limitations while still working toward realistic goals by identifying alternative job opportunities that match the client's current abilities. The counselor helps the client reintegrate into the workforce in a way that is both supportive and achievable. The approach also emphasizes gradual progress and ensures the client's rehabilitation journey is both realistic and empowering. Option A and D focus too narrowly on one aspect, while option C unnecessarily limits the client's potential for work and independence. Question 21. Topic: Vocational rehabilitation techniques. James, a rehabilitation counselor, is working with a client who has a hearing impairment and is interested in pursuing a career in teaching. The client expresses concerns about the communication barriers they might face in the classroom, particularly with hearing students. What is the most effective vocational rehabilitation strategy James can employ to support this client? I advise the client to choose a different career path, as teaching may be too challenging given their hearing impairment. B. Recommend that the client pursue teaching but avoid disclosing their hearing impairment to colleagues or students. C. Suggest that the client explore teaching careers that specifically cater to students with disabilities or integrate technology to facilitate communication in the classroom. D. Encourage the client to try teaching with any accommodations to prove that their hearing impairment will not be an issue. Answer: C. Suggest that the client explore teaching careers that specifically cater to students with disabilities or integrate technology to facilitate communication in the classroom. Explanation: the counselor should work with the client to identify potential career opportunities that accommodate their disability, such as teaching positions that involve students with disabilities or those where technology can aid communication, e.g., assistive listening or captioning. This approach ensures the client's strengths and interests are considered while also addressing their specific needs. Option A limits the client's potential, and option B neglects the need for transparency in the workplace. Option D fails to provide appropriate support, which could be detrimental to the client's success. Question 22. Topic: Psychological and functional assessment techniques. Lily, a rehabilitation counselor, is conducting a psychological assessment of a client who has been diagnosed with depression and is experiencing significant difficulty in performing work-related tasks. The client also has a history of anxiety and struggles with concentration and focus. What is the most appropriate approach for Lily to take in evaluating this client's fun? The imitation A. Lily should focus solely on the client's mental health symptoms and exclude their vocational skills from the assessment. B. Lily should use standardized psychological assessments to evaluate the client's cognitive, functioning, and emotional state, and also assess the impact of these factors on their work performance. C. Lily should recommend that the client take time off work indefinitely to address their mental health issues. D. Lily should assess only the ability to manage their anxiety, as this is the only factor that could impact their work performance. Answer: B. Lily should use standardized psychological assessments to evaluate the client's cognitive functioning and emotional state and also assess the impact of these factors on their work performance. Explanation: the rehabilitation counselor should take a comprehensive approach when assessing the client's functional limitations. Standardized psychological assessments such as the MPI Minnesota Multiphasic Personality Inventory or the WISE WECH Adult Intelligence Scale can provide insight into cognitive and emotional factors. Additionally, the counselor should evaluate how these psychological issues affect the client's ability to perform work-related tasks. This holistic assessment helps to develop an accurate understanding of the client's strengths and limitations. Option A focuses too narrowly on mental health, and C and D offer overly restrictive or partial solutions. Question 23. Topic: Client advocacy and empowerment. Mark, a rehabilitation counselor, is working with a client who is applying for disability benefits but has been denied by the Social Security Administration (SSA). The client is frustrated and feels powerless to challenge the decision. What is the most appropriate action for Mark to take in supporting the client's advocacy efforts? A. Mark should advise the client to accept the decision and not pursue further action. B. Mark should provide the client with information about the appeals process and assist them in gathering necessary documentation for the appeal. C. Mark should suggest that the client explore other sources of income instead of continuing to fight the SSA decision. D. Mark should focus only on supporting the client's vocational rehabilitation needs and avoid involvement in the appeal process. Answer: B. Mark should provide the client with information about the appeals process and assist them in gathering necessary documentation for the appeal. Explanation. As an advocate for the client, Mark should support the client's right to challenge the SR's decision, offering information about the appeals process and helping to gather the documentation needed to present a strong case. This aligns with the counselor's role in empowering clients and advocating for them, especially when they face barriers to obtaining benefits. Option A disregards the client's right to appeal, while C and D limit the counselor's role in advocating for the client in critical area of need. Question 24. Topic: Client-centered counseling. A rehabilitation counselor Laura is working with a client who recently experienced a severe accident and is struggling with feelings of hopelessness and a lack of motivation to pursue rehabilitation. What is the most effective strategy Laura can use to help the client engage in the rehabilitation process? A. Laura should take a directive approach and tell the client what steps to take in their rehabilitation process. B. Laura should use motivational interviewing techniques to help the client explore their values, goals, and reasons for pursuing rehabilitation. C. Laura should suggest that the client take a break from rehabilitation to avoid overwhelming them. D. Laura should focus on the client's physical rehabilitation first, ignoring emotional, motivational issues. Answer. B. Laura should use motivational interviewing techniques to help the client explore their values, goals, and reasons for pursuing rehabilitation. Explanation. Motivational interviewing is a client-centered counseling technique that helps individuals explore and resolve ambivalence about change. By using Laura can help the client uncover their personal motivations and goals for rehabilitation, which can lead to greater engagement and willingness to participate. Option A is too directive and may not foster the client's own intrinsic motivation. Option C could delay the process unnecessarily, and D focuses too narrowly on physical rehabilitation without addressing emotional barriers. Question 25. Topic: Disability employment laws. John is a rehabilitation counselor assisting a client with a disability in finding a job. The client is qualified for a position, but the employer is concerned about the client's ability to perform some essential job functions due to the disability. What is the counselor's role under the Americans with Disabilities Act (ADA) in this situation? A. The counselor should advise the client to apply for jobs that do not require any accommodations. B. The counselor should encourage the employer to reconsider the hiring decision but not offer any further assistance. C. The counselor should inform the employer of possible reasonable accommodations that would allow the client to perform essential job functions. D. The counselor should discourage the client from applying for the job if there is any possibility of the employer rejecting them based on the disability. Answer. C. The counselor should inform the employer of possible reasonable accommodations that would allow the client to perform essential job functions. Explanation. Under the ADA, employers are required to provide reasonable accommodations to qualified individuals with disabilities unless doing so would cause undue hardship. The counselor should facilitate a discussion with the employer about potential accommodations, such as modified work hours or technology that would enable the client to perform the essential functions of the job. Option A limits the client's opportunities, and Option B lacks proactive assistance. Option D unnecessarily discourages the client from pursuing the job. Question 26. Topic: Cultural competency. Tasha, a rehabilitation counselor, is working with a client who is from a cultural background that values family involvement in decision-making. The client expresses difficulty making progress in therapy because their family has strong opinions about the course of treatment. What is the most culturally competent approach for Tasha to take in this situation? A. Tasha should respect the family's wishes and allow them to make all decisions about the treatment plan. B. Tasha should acknowledge the client's cultural values, explore how the family's involvement impacts the client's treatment, and find a way to incorporate family input into the therapeutic process. C. Tasha should encourage the client to assert their independence from the family and make all decisions without their input. D. Tasha should avoid engaging with family at all and focus only on the client's individual needs. Answer. B. Tasha should acknowledge the client's cultural values, explore how the family's involvement impacts the client's treatment, and find a way to incorporate family input into the therapeutic process. Explanation. Cultural competency involves recognizing and respecting the client's cultural values and integrating them into the therapeutic process when possible. by acknowledging the family's role in the client's decision-making and exploring how to incorporate their input. Tasha can ensure that the treatment plan aligns with both the client's values and therapeutic goals. Option A overemphasizes the family's control, while option C ignores the cultural context. Option D fails to consider the importance of family dynamics in the client's cultural framework. Question 27. Topic: Career development theories. A rehabilitation counselor is working with a client who is unsure about their future career direction after being diagnosed with a chronic illness. The counselor suggests using Super's lifespan, life space theory of career development to assist the client in exploring career possibilities. Which of the following would be the most appropriate first step in applying this theory? A. Focus on the client's current stage of life and explore how their career goals fit with this stage. B. Encourage the client to abandon their previous career goals and select a new career path. C. Tell the client to focus only on the current job market and ignore their past experiences. D. Help the client to identify and set long-term career goals without considering their current health status. Answer A. Focus on the client's current stage of life and explore how their career goals fit with this stage. Explanation. Super's lifespan, life space theory emphasizes that career development occurs in stages and that individuals' career goals evolve over time based on their life roles. By focusing on the client's current life stage, the counselor can help the client understand how their career aspirations align with their present circumstance, including health status, and adjust their goals accordingly. Option B disregards the client's previous career experiences, while option C is too narrow and does not account for the client's personal history. Option D skips over the critical first step of evaluating the client's current situation. Question 20. Topic: Goal setting and intervention strategies. A rehabilitation counselor is working with a client who has recently returned to work after an injury. The client is struggling with anxiety and self-doubt about their ability to meet job expectations. What is the best strategy for the counselor to use in this situation? A. Help the client set small, manageable goals to gradually build confidence and success in the workplace. B. Encourage the client to work without breaks to prove their ability to perform under pressure. C. Advise the client to seek a different job that requires fewer responsibilities. D. Suggest that the client take extended leave from work to focus on their anxiety. Answer A. Help the client set small, manageable goals to gradually build confidence and success in the workplace. Explanation. Goal setting is a key part of building confidence and reducing anxiety. By helping the client set small, achievable goals, the counselor can facilitate incremental success, which fosters a sense of accomplishment and reduces self-doubt. Option B risks overwhelming the client, and option C may be premature without exploring the client's full potential. Option D could potentially delay the client's reintegration into the workplace and may not address the underlying anxiety effectively. Question 29. Topic: Case management and coordination. Emma, a rehabilitation counselor, is working with a client who has a disability and is transitioning from an institution to independent living. The client requires assistance with housing, employment, and community services. What is Emma's role in coordinating these services? A. Emma should provide all services directly to the client herself. B. Emma should focus solely on the client's vocational goals and refer them to other professionals for housing and community services. C. Emma should coordinate with other service providers to ensure the client receives comprehensive support in all areas of transition. D. Emma should encourage the client to handle the coordination of services independently to promote self-sufficiency. Answer C. Emma should coordinate with other service providers to ensure the client receives comprehensive support in all areas of transition. Explanation. Case management in rehabilitation involves coordinating various services to ensure the client's needs are met comprehensively. Emma should collaborate with housing agencies, vocational programs, and community services to support the client's transition to independent living. Option A is unrealistic and impractical, and option B leaves gaps in service delivery. Option D may be appropriate once the client is ready but could be overwhelming during the transition process. Question 30. Topic: Assessment of functional limitations. A rehabilitation counselor is assessing a client's ability to perform activities of daily living adults following spinal cord injury. Which of the following is the most appropriate method for assessing the client's functional limitations? A. Rely solely on self-report from the client about their ability to perform adults. B. Use observational assessments in conjunction with self-report to evaluate the client's abilities and limitations in performing adults. C. Ask the client to perform series of tasks without providing any assistance to observe their capabilities. D. Assess only the client's physical limitations and disregard their psychological or emotional state. Answer: B. Use observational assessments in conjunction with self-report to evaluate the client's abilities and limitations in performing adults. Explanation: comprehensive assessment of functional limitations should include both self-report and observational data. The client's perspective is essential, but direct observation allows the counselor to assess the client's performance in real-life contexts, which provides more accurate understanding of their abilities and needs. Option A may not fully capture the client's limitations, and option C could overwhelm the client or fail to account for their potential need for support. Option D overlooks the critical role of the client's psychological and emotional well-being in their ability to perform adults.